Hello, this is Nicole Napier, and this is for the assignment on social workers' roles, specifically in mental health and working with other mental health professionals. So, the first question is, after reading Chapter 3, reflect on the different roles that you as a social worker may take on when helping others. So, when helping others, the different roles a social worker needs to take on are an advocate. As a social worker, we are always advocating for the best care for our clients to make sure that they are getting what they need and when they need it. This is where you work with other professionals and figure out what it is that they need, talk to other people and make sure that everyone is on the same page, but you are always going to be the one looking out, and working for your client to advocate for whatever is best for them. And you are also someone that the client feels that they can confide in. Because you have that confidentiality agreement, you need to be able to talk to your client and be that, so that way you can be a better advocate for them and discuss with them if they want their family there, if they don't want their family there, what you can do to make their experience better and to help them in a more helpful way. So it's very important that you are both an advocate and a confidant for your client. So that way, if they are a danger to themselves or others, you can inform other people, get them the help that they need, and to move forward in their treatment plan. So it's very important that you do these things. It's also extremely important that a social worker is able to be empathetic with the person and to understand. So it's also, the social worker should also be responsible and put in the role of providing resources for their client and making sure that when their client possibly gets out of the mental health institution, that they have the resources that they need to have a better life and to move forward in their life. So, as a social work advocate, you need to focus on the problems that are happening currently that other professionals will also be worrying about, but you need to be thinking ahead for your client as well to make sure that they don't get in this situation again and that they are able to, say, receive their medications that they need and have a system in place that will hold them accountable to make sure that they are receiving their medications. So that is question 1. Question 2 is, what makes social work different from other disciplines in the mental health field, such as the nurses, the pharmacists, the doctors? So social workers bring a value-based approach that is strongly grounded in anti-discriminatory and anti-oppressive approaches. This means that we are going to be non-judgmental when meeting our clients and talking with our clients. When you meet someone who's a drug user or things like that, I know of instances where police and nurses and stuff have a very negative approach to things like that because it is so stigmatized, and drug abuse is one of those things that a lot of people have a lot of strong feelings about. So social workers are different from others because we are not going to judge our clients for what they have done in the past and their addictions and their vices. That makes us extremely different from other people, and we bring that anti-oppressive and anti-discriminatory attitude into our work. And we are one of the few disciplines that we take pride in that, and that is part of our code of ethics that we do that. So that is something that makes us extremely different from other professions. Question number 3. How might we as social workers perform tasks or interface with others in ways that are different from other professionals, i.e. nurses or doctors? So I believe that we are different from other professionals, i.e. not nurses or doctors, because we are non-judgmental and we work with our clients on a personal basis, and we also are very empathetic with our clients, and we understand what they've been through, and we are just kind to them, and we work with them on a personal basis, face to face, to work through their issues together. Nurses and doctors will look at the scans, they will look at the charts, they will look at the symptoms. We will look at the person, and we will look at their background, and we will look at what has led them to this point and how we can help them get out of this point on a non-medical basis, on a personal face-to-face basis, and that leads us to perform the tasks more personally and also more diligently. We care about the people that we work to help. And also, they are trained to look at the symptoms. We are not going to be diagnosing our patients. We are not going to be going in and telling them, you need this medication, you need this. We're just going to be responsible for making sure that they get the treatment that they need. It is not our job to diagnose, it is to treat. So number 4, what roles would we perform when looking at a multidisciplinary team, and how might these roles change us as professionals? So we, in a multidisciplinary team, are mainly going to be working as an activist for our clients to make sure that they are getting the best care and that they are being treated fairly, and that any judgments that have been passed upon them by the doctors, the nurses, etc., are not affecting their treatment of care. We are also looking at what led them to be in this place. Were they abused? Were they neglected? Do they have a drug addiction that's making them this way, in mental health or things like that? What has led them to this point? And we are going to work as an advocate to make sure that they are able to get out of that situation and to work through their mental health and mental health problems, and to find a way for them to receive therapy, receive treatment, get medication, and find a community. And so we will be working as the activist to make sure that they get what they need. And this will challenge us because we will be that person for our client, and might have people disagree with us, or we might have people, we will have to fight for our client. If they are mentally ill or anything like that, then they are not able to properly advocate for themselves. So we are going to have to fight for them, we are going to have to advocate for them, and that will always be a challenge. So yeah. Number 5, what kind of social worker would you like to become, and what population would you like to work with? I am focusing my studies currently on children's services. I've been accepted in the CPP program, UPP program, and I'm going to be doing my field placement at Butler County Children's Services. So that is my current focus, but someday I hope to work with the drug addicted and work in like a rehab environment. So with that, there are also lots of multidisciplinary teams because of the drug addiction and things like that, and you always have to work in teams when you're dealing with children. So I found this chapter very helpful, and I found this class overall very helpful as well. Thank you for your time, and I hope you have a great day.